Hi everyone, Dr. Nemechek. Just to touch on something kind of quickly, I had a recent patient where they had had this athletic injury to their knee, and it wasn't getting better. And you see this, we see that we've dealt with professional athletes for a long time. You'll see this quite frequently. There's some injury, there's an x-ray, there's something not normal, a tear or something like that, and the whole focus is on the tear. Okay, that's the source of pain. And actually, what they may not know is that tear might have been there before the pain even started. Okay, and that the chronic pain that you end up having is, especially when it's just like constant, is from inflammation. It's from chronic inflammation, not shutting off. Now, maybe you got the tear, you get an injury, inflammation starts, it's trying to fix the thing, but it won't shut off. And now you just have pain. Okay? What you'll see in professional sports, they're doing all sorts of modalities to try to get that knee to improve. In this example, get it calmed down, and they're trying to fix the tissue when really they have to fix the kind of the global environment of the body and just turn off inflammation. All right? I had a gentleman who I just know as an acquaintance walking dogs, and he was wearing these knee braces, and I casually said, "What are the braces for?" He said, "I don't know, my knees just hurt so bad I have to have these mechanical braces on." And I chatted for a few minutes, and it started within a few months after he had had COVID, and there was no injury though to his knees. He didn't fall off a ladder or something. And I just said, take some fish olive oil, take 6 weeks of glutamine, like I talk about my other videos about that gut damage from COVID. And I basically forgot about it. I hadn't seen him in about 4 or 5 months. And I bumped into him just 2 days ago, no braces. And he thanked me. He said, "Wow, within a few weeks it all went away." And he had surgeons and all these people looking, and they wanted to do surgery and all this. And it wasn't that. It was just a chronic inflammation. So if you've had some injury, whether you're an athlete or not, and it's not getting better, and I don't care if they show something on the x-ray, treat the inflammation first, and you might be surprised. Because both my knees, from separate incidences, I was told I had to have surgery. Because look here on the films, you can see you got a problem. I have no pain today. I never had surgery. Okay? I've had this shoulder dislocate many times. I don't have any pain, even though if you did an x-ray, it looks like a mess. Why? I have no inflammation. Now, my shoulder, I can't play tennis. I can't bowl. I have some mechanical issues. But if I'm not doing those things, I'm very comfortable. Okay? So not everything you see on the film needs to be fixed with a scalpel. All right? Go after the inflammation first, and you may be shocked at how much just goes away. That's all for today, everybody. Take care.